Do you know that there is a disease which is caused by itching or scratching or rubbing? Yes, we will talk about it today. Itching is one of the most common symptoms in various skin diseases. The mechanism of itching is complex and still not well understood. But to put it in simple words, itching in a skin disease can be thought as the disease itself produces chemicals that stimulates nerve fibers present in the skin, which takes the neural information to the brain via spinal cord, and a specific region of the brain gets stimulated, which we perceive as itching sensation. So, to get relief from that sensation, brain gives signals to our hands to do scratching or rubbing. Today I am going to discuss about a disease where itching sensation followed by scratching and rubbing is the cause of the disease. Yes, my friends, you have heard that right. And that interesting disease is called Lichen Simplex Chronicus. Don't get afraid to hear the name. It is a very common disease. Roughly, if I see 100 patients in a day, at least 8 to 12 patients comes with this disease. It is that very common. So what is Lichen Simplex Chronicus? It is a disease where continuous scratching or rubbing produces a single or sometimes multiple small lichenified elevated skin lesions that appear at a particular area of skin which are easily accessible to our hands, so that scratching and rubbing can easily take place. It occurs most commonly in females and in age between 30 to 50 years. It mainly occurs over the easily accessible area like back and sides of the neck, lower leg, ankle, forearm, upper thigh, scrotum, as well as vulva. Now the next question is, how does it occur? There is a dermatological and a psychological component to it. Patients who have other skin diseases like atopic dermatitis, where itching is a main symptom, may develop Lichen Simplex Chronicus due to continuous itching and scratching. Patients who have tendency to develop Lichen Simplex Chronicus may develop the disease due to psychogenic itching. Just remember that the cycle I told you earlier. From that cycle, you just omit the part where skin disease producing chemicals to transforming the information to a particular part of brain. What remains is psychogenic itching. In easy words, here there is no skin disease, but itching sensation develops within the brain which provokes scratching or rubbing. Very common in older people. We will talk about it in details in some other day. But now back to Lichen Simplex Chronicus. Another important psychological aspect is that it has been seen that many patients with LSC also suffer from anxiety and depression. However, the reason is the continuous itch scratch cycle which produces the skin changes. The skin becomes rough, thick and leathery due to continuous friction. But don't mix this with frictional skin thickening or frictional hyperkeratosis with this disease. Here is no itching involved. Only repetitive work causes a particular area of skin to undergo continuous friction, most likely over our elbow or knees or palms, which causes skin thickening and hardening. That is called frictional hyperkeratosis. It is completely different from Lichen Simplex Chronicus, where there is continuous itching associated with the disease. Now, the next question is, how does it look? Initially, the area of the skin is reddened and slightly thick, which time the redness disappears and that area becomes more thick and leathery. Along with that, hyperpigmentation or darker in color it becomes. As the name suggests, it looks like lichen over a tree bark. Lichen is a small plant that grows over rocks, walls and trees, and it looks crusty. A very typical and diagnostic feature of Lichen Simplex Chronicus is overprominence or accentuation of normal criss-cross skin markings over the affected area, which simply means the skin markings becomes easily visible. The next question is, if the disease is so simple as I described, why do we need to see a doctor? For most obvious reason, that is, it needs proper treatment. And secondly, because it needs to be differentiated from other similar looking diseases like lichen planus hypertrophicus, lichen amyloidosis and psoriasis. Now, what's the solution? Firstly, discussion about the disease process and prognosis with the patient with proper counseling is very important part of the treatment. Breaking the itch scratch cycle is very important. so itching needs to be reduced by proper medication. Along with that, the affected area has to be treated topically with applying proper cream. Moisturizing the area regularly is an important part of the treatment as well. The underlying disease like atopic dermatitis or polymorphous light eruption has to be treated, which primarily causes the itching sensation which provokes scratching or rubbing. If there is any psychological component present, then help of a psychiatrist may be needed. I hope you gained some knowledge about this very common disease. I will meet with you guys in my next video. Till then, take care, be safe, be happy and healthy.